After an above-knee amputation, one of the most important aspects to regaining functionality is following a physical therapy plan. The purpose of this video is to outline an easy-to-follow, home-based exercise program that will increase flexibility, muscle strength, endurance, balance, and coordination. One of the biggest challenges for an above-knee amputee is maintaining flexibility at the hip. If the hip is not stretched, contractures are likely to set in. A hip flexion contracture is the permanent fixation of the hip in a flexed position with limited passive or active motion at the hip joint. Hip flexion contractures make walking extremely difficult, especially on a prosthesis. The following exercises increase flexibility and muscle strength at the hip, which reduce the chances of developing a hip flexion contracture. As a rule of thumb, these exercises are suggested to be repeated 10 to 12 times per set, 1 to 3 sets per session. However, this is only a suggestion. The duration and frequency of these exercises always depends on your specific activity level and what your physical therapist advises. Now we are going to begin our table exercises. These table exercises are designed for a very recent amputee or someone with reduced muscle strength, and they can be modified by removing the bolster, making the exercises more difficult. Our first exercise is bridging, which focuses on strengthening the hip extensor muscles. Lie down and make sure that your back is flat on the table. Place a bolster or a towel under the back of your thigh. Slowly squeeze your buttocks and push your hips off the table towards the ceiling by extending your residual limb. Extension of the residual limb is achieved by pressing downward onto the bolster or towel. Slowly count 1, 2 while lifting and 3, 4 while lowering. Your hands should be positioned on your stomach in order to avoid the temptation to use them during the exercise. After finishing, make sure to complete a set on the opposite side in order to maintain muscle strength balance between both of your limbs. The next exercise is quad kicks. The quadriceps muscles extend your knee while standing in order to prevent your knee from buckling. Maintaining quadriceps strength on your sound side is an extremely important factor in creating standing stability for the transfemoral amputee. Continue lying down and make sure that your back is flat on the table. Prop up the underside of your thigh using a bolster or towel so that your knee is at the 45-degree angle shown. While keeping your knee in place, lift your lower leg so that it is extended straight, then lower it. Slowly count 1, 2 while lifting and 3, 4 while lowering. If necessary, place your hand on your knee to keep it steady. Only the lower part of your leg should be moving. Our next exercise is the straight leg raise. This exercise is similar to the quad kick, but instead of bending and flexing at the knee, you will lift and lower your entire leg, keeping it straight. Make sure that your residual limb is propped up on a bolster or towel at a 45-degree angle. Lift and lower your leg as high as you can without lifting your hips off the table. As you first begin doing this exercise, try to lift your leg to the level of your residual limb. There should be no bend at your knee. Keep the leg extended throughout the entire exercise and tense up or lock the knee. As you raise and lower your leg, continue counting as described earlier to keep pace. This exercise focuses on building strength and control at your hip flexors and abdominal core. Throughout the entire set, remember to keep your abs tight and firmly pressed against the table. Do not lift your hips off the table at any time. Next is side-lying abduction. The hip abductors and gluteal muscles are the stabilizing forces in a transfemoral residual limb. Strengthening these muscles is very important in increasing standing stability and redeveloping a natural-looking walk. Weakness in the abductors can cause side leaning of the shoulders and trunk while walking in a prosthesis. To begin this exercise, maintain your previous position on the table. Roll towards your amputated side, placing the bolster or towel under your residual limb. Make sure your hips are both vertical. Avoid moving your hips toward the front or back during the exercise. Squeeze your buttocks muscles in order to lift your hips off of the table. Hold this position for a count of 3 and slowly lower your hips back to the table. As you strengthen your abductor muscles, the bolster or towel can be removed to increase the difficulty of this exercise. After finishing the set, make sure to complete a set on the opposite leg as well. Prone hip extension. This next exercise is not only a great strengthening exercise, but also a great stretch. Lying prone on your stomach, allow your hip flexors to lengthen. Firmly press your hip bones against the table throughout the entire exercise. Squeezing your buttocks, lift your residual limb off of the table. Hold this position for 3 seconds and slowly lower the limb to the floor. After finishing the set, make sure to complete a set on the opposite leg as well. If you're looking for more ways to stretch your hip flexors, you can also place a pillow under your residual limb to perform a passive stretch. Quadruped leg lift. This exercise is focused on strengthening your gluteal and hip extensor muscles. To perform a quadruped leg lift, get into position on your hands and knee. Your hands should be aligned below each shoulder. Point your fingers forward and your foot out behind you. Keep your back in a neutral position, neither arched nor sagging, by keeping your abs and core tight. Move only your hip joint. Lift your residual limb towards the ceiling until it is parallel with the floor. Make sure to keep both hips at the same level throughout the exercise. Do not raise your hips as you raise your residual limb. Next, we are going to move into balance and coordination with some standing exercises. The previous table exercises were designed for the more recent amputee. Keep in mind that these next exercises are more advanced and should only be attempted after your physical therapist tells you it's okay to stand and that you can begin exercising. Maintaining balance and stability on your prosthesis is key. Be careful and use a support like a chair while standing on a new prosthesis. Even the strongest people have difficulty performing these activities without some extra support. Basic weight shifting. To begin this activity, use parallel bars or 2 chairs for support. Stand up straight, keeping your core and trunk tight, making sure to keep your head forward and look at the wall in front of you. Do not look down during this exercise or bend your back. Slowly shift your weight from side to side. Make sure not to use your trunk or your hips to move from side to side, but slowly move your entire body's weight over from your sound side onto your prosthetic side. Take extra time to become aware of what it feels like to weight bear on your prosthesis. Now to expand on the basic weight shifting concept. Slowly step to the side, bring your feet together, and step to the opposite side. You can continue this pattern in place, or if you feel comfortable, you can sidestep along the length of a wall or railing. This exercise will begin to familiarize you with what it feels like to use your prosthesis, to sidestep, and teach you how to correctly balance by dividing equal weight between your sound leg and your prosthesis. The single leg balance. Place a step stool in front of you. Keep your chest and head up and put your sound leg on the stool. As you become more comfortable in your prosthesis, you can actually hover your sound leg over the stool and use your stool just in case. At this time, your body weight should be supported solely by your prosthesis. Ball rolling. This is a very good balance exercise that not only forces you to weight bear solely on your prosthesis, but also trains your muscles to stabilize your prosthetic side while your sound side is moving in many directions. Start off with a small tennis ball and roll the ball forwards and backwards and side to side with your sound leg. To make this exercise more difficult, you can increase the size of the ball. Using larger balls causes your muscles in your prosthetic side to work harder to stabilize. Attach resistance bands to a fixed location, such as a pole or a heavy table. Place your sound limb in the loop. Stand up straight, keep your head forward, tighten your core muscles, and focus on not moving your shoulders or your pelvis throughout the exercise. Lift your leg forward by flexing only your hip flexors. This exercise can also be done backwards and across. Remember, when working on balance and stability while wearing your prosthesis, never move your shoulders or your hips to balance. Balance should be achieved by the stabilizing muscles in your residual limb. The last thing we're going to cover today is maintaining residual limb volume and decreasing pain through the use of a figure 8 compressive wrap. Begin at the bottom and in the front of the stump. Cover the bottom of the stump and continue upward towards the top of the stump. Wrap 2 to 4 diagonal turns around the stump. This keeps the ace wrap over the end of the stump in place. Begin a figure 8 or crossover pattern to cover the sides of the stump. Pressure should be directed upward and outward from the end of the stump as you wrap. Take the bandage from the front, inside of your thigh, and wrap upward and outward across the front of your hip joint. In the example shown today, we did not have enough ace wrap to go around the hip. In a case like this, you would add an extra ace wrap and wrap it circumferentially around your hip joint in order to anchor and continue to bring compression from the distal part of your limb upwards. Our instructional video would not be complete without reminding you that before and after you complete any exercise, apply any ace wrap, or wear your prosthesis, that you must check your skin. Keeping your skin in good condition is an extremely important part about keeping you healthy and active. Things to watch for after taking off your prosthesis or completing an exercise are areas of redness and irritation lasting longer than 20 minutes, or any areas of skin breakdown.